to the next presentation, and it comes from East London NHS Foundation Trust, who, despite facing operational challenges, are digging out blind for the armed forces community. Firstly, I wanted to introduce Jane Kelly, Recovery Lead and Clinical Lead for the Armed Forces community, who has led the Trust to achieving Veteran Wear accreditation and indeed MOD Gold ERS status. And joining her is Sharon Deems, Armed Forces Accreditation Lead and Champion, who has played a key role in the Armed Forces Alliance a key role in the Armed Forces Alliance. I'd like to hand you over now to both Sharon and Jane. Sharon and Jane.
Thank you, Guy. Can we have our first slide, please? Thank you. And we'll just jump on to the next slide. Thank you. So we're here today really to talk about the work we've done across East London Foundation Trust. And the name itself, I think, is a bit difficult one to understand because we actually cover services across East London, the City of London, City and Hackney, Newham and Tower Hamlets, which is a huge diverse population. And we also cover service across Bedford, Luton and Central Beds. So we're a huge trust, and both me and Sharon have a trust-wide job. I also want to say it's not actually my full-time job. During COVID, at the beginning of COVID, I was asked by my manager at the time, could you just take on this little project to get us some accreditation for the armed forces? 5 years later, despite it not being my main job, it's the main passion in my life and something I devote a lot of time to. So as an organisation, we are mental health services, but we also have community health services across our trust. We have our own primary care and GP services in 9 centres. We have talk and therapies. We have forensic services and one of the largest forensic inpatient services in the country. We also cover drug and alcohol services. We have specialist mother and baby units. And we have over 120 sites, 900 beds, and we employ over 10,000 staff. And there's me and my mate Sharon, and we have been tasked to raise awareness across this large organisation. So we just want to talk through how we've used quality improvement and the art of conversation to really spread the message across the organisation, and really thinking about what treasures we have within the trust who can help us on this journey. So can we have the next slide, please? So we have, as Guy said, been really honoured on our journey so far. We did sign the Armed Forces Covenant about 5 years ago, and we really need to start thinking about re-signing it actually and thinking about our pledges and updating them. We set up our Elfed Armed Forces Line Project Board around the same time, but that has changed over the last 5 years, from a networking board to more of a strategy board, and I'll explain a little bit more about that later. I think the most important part of our Alliance Project Board is that it's been co-produced from the very get-go. I was asked to be the clinical lead. I am a clinician, 32 years as a psychiatric nurse, senior manager and project lead within the trust. And my partner in crime with this is Dr. David Bridle, who's the medical director from the trust. But neither of us are from an armed forces background. A bit like Kate's story at the beginning of the day, I don't have any military experience in my personal life or my family life. So it was really important from the very get-go that we had the Armed Forces voice as part of our alliance, and it's a real pleasure to still be with Sharon today. So we set up the project board, and we worked through gaining our Veterans Covenant Healthcare Alliance accreditation, and we got our 3-year re-accreditation. And as Guy said, we got our Gold Award. We have been on this journey under the quality improvement umbrella, and it was really interesting to hear from a previous speaker talking about the importance of that and really tying it into the trust's priorities around pursuing equity and health inequalities. And it was a real turning point, I think, in our project when we started thinking about the armed forces community and the health inequalities that they faced. but it hasn't been without its difficulties. It's been nice. It's been very rewarding to be given awards, to have the purple tick in reception in Trust headquarters. But we were really concerned about what impact does this have on frontline staff, and what impact does this have on service users and the wider community? And do all our services understand that we are a veteran aware trust? To quote a very northern saying, it felt like we were all fair coat and no knickers at one point. And we really wanted to think about what impact we'll be having on our local communities. So we set up a local accreditation scheme where we really did take the accreditation criteria for the VHCA and really started to think about what that meant for local teams. And we really wanted to start thinking about embedded local champions. We have, as I said, a workforce of about 10,000, and that is changing every day. So we think we've got somewhere with training people, and then there's a whole host of new people coming, people leaving. And that's the same with our service user group. So we needed to start thinking about how can we embed the changes into practice that wasn't personality driven by people from the project board. So I'm going to hand you over to Sharon now to talk a little bit more about her role as a local accreditation scheme lead. Thank you.
Hi everyone, thank you for having me this afternoon. As Jane said, we've been doing this about 5 years. It was actually 5 years ago yesterday that I was given the opportunity to come on board, thinking I was just answering a few questions that could enhance things for the armed forces community that I'm a part of. I am the granddaughter, daughter, wife, mother and mother-in-law of somebody that's part of the armed forces community or has been. And I'm very proud.
Sorry, Sharon, can we have the next slide, please? Oh, sorry, Sharon.
Sorry, this is some of my family, my husband and my son in the middle. My son, the day he passed off, with me at the bottom. Me, my husband and my children. I have 5 and 6 grandchildren. My son and his now wife, and then my son-in-law and my daughter, the day he passed off and joined the Army Air Corps. So I'm extremely proud of this community. So to be given the opportunity 5 years ago to answer some questions to enhance things for my community, I thought, okay, no problem. Jane was at the end of the phone asking these questions, and at the end of it, I got welcome on board. Sat there a bit confused, thinking, well, I was just answering some questions. What have I just joined? It's like being in the Victorian era, being given sort of a drink with a king's shilling in the bottom. You're looking at it, and then the next thing you know, bag over your head, and you've been press ganged into joining. But it was the best decision I've ever made, and I'm very proud to sit here alongside Jane doing what we're doing today and being able to enhance the opportunities for the armed forces community. Can I please have the next slide? As you can see here, we chose to have our bronze, silver and gold award levels that we're doing, and we wanted to have this at a level that it was easy to go through. We wanted to get out there and have awareness raised like everybody that's here today. And we found that going out to teams, not just on a meeting like we're doing today, but trying to get out into the community and have those personal meetings was what was important. And we chose to have our conversations and adapt our presentations to each of the teams we went out to. And we spoke about the need for champions, the need for having people to help us raise awareness across this large organisation. As Jane said, over 10,000 staff, it's not a small job. Our bronze level was to get a team to identify a champion, as you can see, to have us invited to a meeting to go along and say why we wanted people to do this, why it's important to understand the armed forces community. If you know your audience, you know that you can communicate and break down barriers that are there. And especially in the armed forces community, we've got a habit of putting barriers up quite high and not letting very many people in. We've got different levels of online training that we get the staff to undertake. We had a basic level that we wanted them to do a bronze award. Adding a logo and to your email signature to show that you're veteran aware is a really easy win, and you don't want to make things difficult, and we didn't want our champions to have to do a lot of extra work, and making information military friendly. I'm from a military community coming into the NHS, and having a lot of your acronyms for me is quite difficult, and it works the same way. The military community need to understand. Silver Award, getting people to ask those questions that I've noticed this morning, everybody across the board is saying the importance of. You know, we want to know who our community are, how we can help them, and you can't help them if you don't ask that question, whether it be your staff members or the clinical recording of the patients that you're working with. We've found that it's been quite difficult across the board, and a lot of people, when we've gone out to the teams, didn't realise they were part of the Armed Forces community. And with Jane, we've added the bereaved families to our work now, and it's really important. Gold Award, we've got a bit of online advanced training, and we want to actively recruit Armed Forces community, not just veterans, but their family members too. We've got lots of skills that can work within the NHS. Collate and act upon service user feedback. Who doesn't need that? But if you don't act on that feedback, you're not going to make the changes that are so readily needed. So we've ensured that we're doing that. Can I have the next slide, please? So, as I said, we go out to our teams and we have people that want to come forward and become an Armed Forces member. So I have a chat with them on a Teams meeting, because I think it's much nicer to get to know somebody and let them know what the role would entail and what we're expecting of them. We understand as a team that everybody across the NHS is extremely busy right now, and that we didn't want to enforce people becoming members, but having volunteers coming forward has been great. We currently have 12 champions and more wanting to come on board. When the teams have identified that champion, as I say, we have the meeting, but I also send them a little goodie bag of a lanyard and some other bits that can help them to promote the fact that they're part of the Armed Forces community and they have an understanding, and that they're a champion that's there for you. Then we have the team is invited to come to our bi-monthly meeting, and we ask them to make sure that we're invited to any meetings that they can't do or that we could attend, to be able to put out there why it's so important to understand the covenant, why we've signed it, and the work that we're doing. As Jane said, we have all these awards. There's no point having an award if nobody knows what it's there for or why we're doing it. And we found that as we were going out to the teams, a lot of them didn't know that we had our purple tick or what it meant. Then we have buddies. As Jane said, we've got an Armed Forces Alliance where we meet bi-monthly and we come together with different agencies such as OpNova, the Poppy Factory, and any other agency that we can bring in. We've had Little Troopers, we've had the Military Wives Choir, who I'm a very proud member and trustee of, and the Ripple Pond have come along, who I'm also a one-to-one and a service user for. It's about engaging and connecting and making sure as a team that we are working together. I also am there for the champions if they need something or just to connect them with other people, as is Jane. We do this together along the whole journey, and we make sure that they're going out to their teams and that data's being collected. That's all done by informatics, as you can see, and we try to make the process as easy as possible. I'm not a huge data person, and although I have done my quality improvement and I did do well and got asked to go further, I'm going to leave the next bit of data to Jane. But I'd like to say thank you to all of you. And one bit that I have is someone serving in the armed forces, for them, it's life's not a choice, it's about a duty. And we need to remember that when we're working with the members of the armed forces community. Thank you very much.
Thank you, Sharon. Just a little bit about the data, because we're not here to present our data today. We didn't have time to do that, but we just wanted to highlight that it's really important that we use a quality improvement framework, and we had clear measurements, but it was never as easy as we originally thought. We thought, let's look at how many veterans, and I've put a graph there, are open to mental health services. And we were looking at that data, and sometimes it didn't change, and we wondered why. But that data doesn't tell us how many veterans have been discharged from our services. So it doesn't really give a true reflection of people that we've seen. Because for secondary mental health and because we've got such diverse services, some people may only get care and treatment from us for a short while. So it didn't really give us the movement or the flow of people throughout our service. And one of the data measurements that we really wanted to look at was, rather than how many veterans are open, how many times we're asking the question, because our target was, we want to ask this question 100% of the time. So we've been really, really working on that at the moment, thinking about how we get the number of times the question is asked on our clinical records. It's difficult because we don't just have one clinical record, we have different systems that record things differently. And as Sharon said, we also wanted to look at the number of staff identified on an electronic staff record, and this is increasing every month. We get this data and we look at it, and it's really interesting to think about the breadth really across all our services of our staff who identify from the armed forces community. So we look at reservists, we look at, you know, current serving members of the family, we have people from the wider, like cadet leaders, etc. So we really do collect as much information as we can and set up a network for those staff. We've worked alongside our human resources department as well, thinking about training for managers around this, because it is difficult. It's awful actually when you put the news on at the moment. We're seeing conflict, war and tragedy constantly, and that must have an impact on people who serve or have served or are part of that community. And we just wanted our other staff to be aware that you could be working alongside somebody who's really impacted right now on a personal level of what's going on in the world. So just to be more mindful of that. So we are supporting our staff to identify themselves on electronic staff record and really thinking about how we can support people and give people the networks. And Sharon underplays their part, but she really is there as a listening ear for people. And a lot of the work we do is around that. We have our own webpage. We're not great at updating it, but we try our best. But we do know that hits to our webpage, which we monitor, is going up every single month. And this is a direct response really to some of the change ideas we've been doing. We're the second most viewed web page after job vacancies. So that's really rewarding, that people within the organisation are looking on the web page and looking at what there is available, because we're really clear. And as a clinician, my role is to kind of, you know, end that circle. It's really good raising awareness. It's really good identifying. But what about personalised care? And what about treatment, and what about what's available? So we need to do a little bit more work on that. But it's really interesting that people are now looking more at the web page. I'm not doing this in any order, as you can see. I'm very random. So one of the main, I think, criteria for us, and which was really essential, and I've mentioned this earlier, was having the co-production from the very beginning. I don't use lived experience. I use the term living experience because I think that better sums up really the people I work alongside, because they're all still living this. It's not done and dusted. They're still part of a military family. They're still a huge part of that community, and that changes each day. So we tend to think about living experience now, because there's no end to this. And what they bring to the table is essential. We couldn't do this work without them. When we do go out and we train, I do the boring stuff. But when I train with somebody like Sharon or one of our other champions who has living experience, that's where we get the shift in staff attitude. Most staff in the NHS will change their attitude from a moral compass perspective. And when they hear, and as we've heard today, some of those real personal stories, I think it does shift how staff see this work. We've also done a lot of work around our training programme and made it as bespoke as we can, because we are so diverse. So, for instance, when we've gone out to do training and awareness training for our children and adolescent services, we've really tailored that to the needs of children and families, and not done the generic training. It's been really good the last couple of weeks. We've linked in with Jim Maskell and Sarah, and we've got our first national training session for our champions arranged. So thank you to Jim for that. And we really do want to tie in our training to make sure it ticks all the boxes from the national programme. And I know Sharon's going to work alongside Jim in delivering that. I'm really keen to get our champions as trainers in their own right. So this runs through the organisation. So thank you, Jim. You've been absolutely amazing in getting us on par with that. So the other just points really, for any big organisation, please, you need senior leadership support. You can't do this work without your time being freed up to do it. You can't do this work without other people taking it back to their teams, and do use some of those treasures you have within your organisation. So we have our director of estates and facilities who's so committed to the work that we do. So we use him a lot really to get our message across in some of the meetings that he goes to. And they've done some great work with procurement around tendering services to external organisations and making sure they're aligned to our values about the Armed Forces Covenant. We've also, as I said earlier, really linked this work to trust priorities, really around the health and equalities of our local community, and made sure that that's tied in to our annual report and annual strategy. And really now thinking about how we tie this into some of the changes in the 10-year NHS plan. And it's been really interesting actually hearing that as a theme running through most presentations today. So it's kind of onwards and upwards. It is difficult. We've done this work through COVID. We're doing this work through a huge transformation of NHS services at the moment. We're very mindful of that. We try and be as sensitive as we can to the teams who are going through consultational change and support them as best we can to ensure the work continues without putting an extra burden on them. And it's really important as well that we celebrate our success. And I think going out to the teams to give them their rewards will be the next stage, and we will celebrate that. And I think that's really important. So thank you for your time. And I just want to say thank you to everybody else. Anna Marie in particular, who's kept us on track for many a year. And please reach out to me and Sharon if you want any further information. So thank you.
Jane, Sharon, what can I say? I'm humbled by what you've just described in your journey, actually. And I've got Anna Marie and Jim sat next to me who are grinning like Cheshire cats. And in fact, Jim was telling me that you tell him what to do and he just does it. So he likes that approach to the training. But I think, yeah, I just want to thank you for a realistic but really positive presentation. So, you know, I'm going to say back at you, thank you for all you do, both of you and the people in your trust. So that's a great start to move on to our next speaker. So thank you very much, Jane and Sharon.